That message makes me so happy. Thank you, Daniela. Yeah, there's a lot of little learning points in that message. First of all, making sure, well, when you can diagnose things well, or, provide a accurate assessment, it eases the concern often that it's something more serious. So, especially the pain she was feeling, costovertebral joint pain, can be a pain that feels like it's going straight through your chest, and it can mimic having a heart attack. Quite often, people go to the emergency room thinking they're having heart attack symptoms when it is a costovertebral joint dysfunction. Now, I'm not going to tell you not to go to the emergency room when you're having symptoms like that, because it could be heart related. But why it's important to do a thorough assessment on people, even when it's virtual, if you are that type of provider, is because having the knowledge of what it is and that it could be something not so serious just makes people start to feel better, feel safer. And when people can feel safe, that's when the magic can happen in terms of healing in general. So, that was step one. And then step two is identifying, okay, why are you having this recurrent instability of that joint? And that's where the LTAP comes in to play. And a proper movement assessment comes into play, and seeing what the interconnection is between any visceral or central nervous system protective patterns and the movement system. So in her case, the LTAP, which stands for the Locator Test Assessment Protocol, it led me to her upper esophagus being where the protective pattern was. And it makes sense because if you look at the segments most associated with the esophagus, the area that she was having the instability is almost related to the esophagus. So I have no doubt that they were interconnected. And then the pain she was having in her, well, she was calling shoulder, but it was actually not really her shoulder, her upper back, well, let's say, with shoulder movements, also changed when we inhibited or did some treatment around the esophagus, upper esophagus specifically. So once we could identify that, we did some really simple drills for this area, technically actually drills that would also be considered cranial nerve drills for the glossopharyngeal nerve, some humming and gargling. And then once we got treated that and got her body a little bit out of the protection pattern, then I layered in some actual good quality movement exercises targeting a weakness that she had. And doing it in this specific order, that's really important. I want to always set her up from a movement and exercise standpoint in the best possible scenario that she has the most positive movement experience, and I don't have to cue a lot. The body just does it on its own. So even that, it's important to say that it became much more clear what her true actual weakness or musculoskeletal problem was once we got rid of some of the layers of the protection pattern. It went from her looking like she was, lacking upward rotation and general scapular control to actually identifying that it was not just the scapular control piece, but some oblique strength as well. And so that was important because it took me from a list of many exercises I gave her to picking 2 specific ones or 3 specific ones that were going to make a big difference for her. So her instructions were okay, in between these exercises and throughout the day, I want you doing this stuff directed at the visceral piece, and then and then doing the exercises, and the sequence does matter. And so when you set it up like that, again, that means that I'm setting her up in the best possible scenario for the movement to be like fully integrated and natural, as opposed to her having to like think about a bunch of different like direct cognitive cues on how her body alignment should be. And the exercise I picked also forces her to create this movement experience. So providing some specific constraints around the exercise can be really helpful too, and not having to like do a lot of like teaching of proper movement. So obviously kind of a lot to unpack, but hopefully that gives you kind of a good perspective and like appreciation for how I utilize the LTAP within a session, even when it's a virtual session, and then how this philosophy gets applied, not just from a manual therapy and assessment standpoint, but from an exercise standpoint too. And for those of you who've listened to the podcast already from this week, or like are about to, you might hear me talk about too how I don't like labeling things as like a strength issue or like a muscle problem when they're not. And sometimes there is a little bit of a weakness, and it is apparent, but she's already feeling better and stronger. I don't think it's so much of the exercises as the other stuff that's making a difference. So the fact that she's already feeling so much better means, like I said, it's the other things that are helping more than just the exercises, though the experience of the exercise is creating a different sort of dynamic alignment for her throughout the day. But she's not gotten stronger with 1 week of exercises. But the end goal is to improve the stiffness around that joint through these exercises, so that when, let's say, her esophagus flares up again, her body is less likely to have a problem there at the musculoskeletal area, because there's no longer a inherent little bit of an instability there, because she has some dynamic stiffness around it from the hypertrophy of the muscles. So the strengthening piece is a long game. But I know exactly why she feels better, and it's the other stuff we did.